Onc Live Insights is a video editorial program produced by Onc Live.
Imatinib is a receptor tyrosine kinase inhibitor that inhibits many receptor tyrosine kinases, including the KIT receptor. The initial studies done with imatinib in patients with unresectable or metastatic gastrointestinal stromal tumors showed a response rate over 50%. This was dramatically different compared to all the chemotherapies that had been done prior to the availability of imatinib.
The biggest advance for care in patients of gastrointestinal stromal tumors has been the advent of imatinib therapy. Imatinib is the tyrosine kinase receptor inhibitor that is given orally, and it basically blocks the KIT oncoprotein, among other proteins. Importantly, before imatinib, patients that had resectable or what we call localized gastrointestinal stromal tumors generally had a recurrence rate as high as 60% at 5 years. If a patient was diagnosed with metastatic gastrointestinal stromal tumor, they essentially had a median overall survival of about 19 months. With the initiation of imatinib, though, we have found that those parameters have all drastically changed. But along with that, so has improved the imaging, diagnostics, as well as the surgical aspect of care. In terms of imaging, imaging of gastrointestinal stromal tumor can involve CAT scans. MRIs can be performed, but they can be sometimes a little bit more difficult to interpret and best interpreted by a musculoskeletal radiologist. And finally, PET-CT imaging has become a modality that is more common. We believe that responses to imatinib are seen earlier on PET imaging, and so many centers are beginning to incorporate the use of this. And it can be particularly helpful if there's any question as to whether the therapy is working or inducing a response in the patient. Importantly, when surgeries are performed for the management of GIST, the goal is complete gross resection, which includes negative microscopic margins. In other words, the goal would be to remove any or all of the tumor present and to ensure that there's no evidence that you're leaving disease behind. So endoscopic procedures are probably best utilized in high-volume centers with surgeons that have expertise in the management of laparoscopic resection of GIST. And it should probably be best reserved for patients that have small to intermediate sized GIST, meaning tumors that are about 2 to 5 centimeters in size.
Gastrointestinal stromal tumors, unlike adenocarcinomas of the GI tract, are treated quite differently. Often with adenocarcinomas, we need to have a wide margin of resection. For instance, in gastric cancers, we usually try to have a 5 centimeter margin. In the small bowel and large bowel, we also have a large margin of resection to take the tumor out. Gastrointestinal stromal tumors differ from this in that the resection margins can be much smaller. Often we just need to have negative margins, which in the stomach, for instance, means that we often can get away with a wedge resection, and the same thing applies for the small bowel and large bowel. Additionally, the way these tumors metastasize compared to adenocarcinomas is also quite different. Adenocarcinomas often metastasize through the lymphatic system as well as hematogenously, whereas the gastrointestinal stromal tumors rarely, if ever, metastasize through the lymphatic system. As such, when we resect these tumors out, we do not have to take lymph nodes in the resection specimen.